Good afternoon, everyone. Welcome to ANCOR's second member briefing on COVID-19. My name is Donna Martin. I am the Director for State Partnerships and Special Projects, and I will be your host on this session this afternoon. A few quick housekeeping notes before we welcome our guest speakers. Please know that this briefing is being recorded and will be available on the ANCOR website tomorrow. Please remember to use the Q&A function on the bottom of your screen to pose questions. So if you look at the bottom, you'll see right near the middle a folder, a file folder that says Q&A. As you have questions, please post them there. If you are listening on the phone and not on our Zoom platform, please just send your questions to me via email and we will address them in the FAQs as soon as possible. We will take questions as time permits. And as I just mentioned, we will have an FAQ to be developed and available on ancor.org/COVID-19.
Hi, this is Dr. Rader, available for any medically related concerns or questions, either now or after.
Thank you very much, Dr. Rader. That's perfect timing. I wanted to take a minute to let you know who is going to be on our broadcast this afternoon. From the Community Provider Association of Oregon, we have Lorelei Lavoie. From Community Residential Services Association in Washington, we have Scott Livengood. With the Kentucky Association of Private Providers, Amy Stade. And with the Oregon Resource Association, we have Lois Gibson. We also have Mr. Brian Riddle from Professional Medical Fulfillment, Dr. Rick Rader, as he just introduced himself. And then we also have Barbara Merrill and Shannon McCracken from ANCOR. So at this time, what I'd like to do is welcome Barbara Merrill to share a message with our members.
Thank you, Donna. Hello, everyone, and greetings from my dining room, where I am now working remotely from Arlington, Virginia. I'm just going to take a minute at the outset of this briefing. Once again, there are a very large number of you who've joined us. Thank you so much. Obviously, the situation has been changing dramatically from day to day, and in some instances from hour to hour. When we did our briefing last week, there wasn't a whole lot of information. We were begging, our federal partners to give us stuff. Clearly, what's been happening since, and you're going to hear more about it, and many of you are telling us about it. You're starting to get guidance from the state. This environment is like nothing any of us have ever lived through. As I sat down to kind of think about what I wanted to share with everyone at the outset, I couldn't help but harken back to the words of Angela King, now our past president, but when she was president and opened up one of our conferences just a couple of years ago, I think it was in 2017, she quoted the words of Esther in saying to all of us that we were born for times such as this. I think, those times have become plural. Clearly, these are truly uncharted waters. We at ANCOR, speaking on behalf of all of ANCOR staff and on behalf of the ANCOR Board of Directors, the ANCOR Government Relations Committee co-chairs, we are honored to be representing you. We know what it is that you are both facing, and what is obviously going to become more and more important.
Barbara, if I could interrupt you, some members are telling us they're having a hard time hearing you.
I'm sorry. I was asked to speak very, very loudly. I'll just repeat. I'm going to quote in the words of the immortal Angela King, quoting Esther. We were all born for times such as this. We are honored, we are privileged, we're humbled by the work that all of our staff and the board of directors and the Government Relations Committee co-chairs are doing to represent all of you. You're going to hear from Shannon in a little while. Our government relations team is working overtime to make sure that any package that goes to Congress is going to represent all of our members. There's been a whole lot of conversation in the ANCOR forum. We are going to continue to share all of the best practices, which a perfect example of which is this webinar. But before I close out, I would just, thanks, folks. Thanks, folks. I thank you. Over to you, Donna.
All right. Thanks so much, Barbara. We appreciate that. We're going to turn now to our two state association directors from Oregon. We've asked them to share some of their experiences as Oregon was a state that really tried to get out in front of this epidemic and provide support to their communities, and particularly to IDD providers. So we have Lois Gibson from the Oregon Resource Association and Lorelei Lavoie from the Community Provider Association of Oregon, who have agreed to share what their experiences have been. Lois, would you like to jump on first? I can see that you're on, Lois. We can't hear you. So I'll let you try to work out your sound. And Lorelei, are you available?
I am here. Can you hear me?
I can.
Wonderful. Good afternoon, everybody. So in Oregon, the state Developmental Disability Services first issued a transmittal on March 3rd, which encouraged all of us providers to be reviewing our emergency plans, specifically as it relates to pandemic, reviewing our staff training to those plans, and infection control practices, along with reminders to keep people home if they're sick, wash our hands, all the things that we've all been hearing. We have had several transmittals come after that in regards to elevating the situation. So the next one involved sending our emergency plans to the state with some additional requirements, specifically related to COVID-19 and what we know about it. Those things included things like limiting visitors to the group home, which of course brought many questions regarding HCBS, because Oregon is 100% HCBS. Our programs are all the residential programs anyway, are maxed out at 5 individuals. So their guidance there was that we could limit a visitor if they appeared ill, if they had been in known contact with a confirmed case of COVID-19, and if they were symptomatic. So we made sure to send this information out to our staff, starting with the March 3rd transmittal information right away. We have posted signs on all of our doors, letting visitors know what we would expect. But then also we have encouraged, the state has encouraged all of us to make sure that visitors are washing their hands as soon as they're coming into our programs, things of that nature. Where it has gotten stickier is for supported living types of environments, or day programming has been a challenge. The state released more guidance on Friday that day programs will be shut down. I believe it's effective this Wednesday, though many of them have already chosen to do that. So on the residential side, we're busy absorbing this and preparing individuals for what that looks like. The state did produce a couple of short videos that are illustrative in helping the population we support understand what the virus means and why all of a sudden we're all about hand washing and not touching our faces, which was really good information. There is discussion about how day programs who now have staff without work and residential providers who now have the need for more employees can work together. So we don't have all of that defined yet, but those discussions are happening, which I appreciate very much, because as a residential provider without day programming, we are feeling the pinch. Let's see. We have the state health authority has been very active. There have been weekly phone calls with the Oregon Health Authority, as well as in the county that my organization operates in. There have been weekly phone calls with them as well. So we're getting good information from statewide, along with information at the local public health level. I'm not sure much has been done with the information with the local public health department, but they have done some polling of residential providers on what types of supplies we have in stock and where we're lacking. So my hope is that we will have a path to get some supplies, especially for PPE and disinfectants if we deplete our supplies, because purchasing online right now, as you all probably know, is a barrier. Let me go through my list. Other things. One thing at my organization that we feel is really important, because many of the folks that we support don't do their own personal care, the staff do it for them. Oftentimes helping them wash their hands or use hand sanitizer can be overlooked. So it's really important to make sure that we're paying attention to that, in addition to making sure the staff have the tools they need to keep their hands and surfaces clean. We all know we need to plan for staff shortages, but with schools closing, creating childcare issues, there's additional barriers there that we don't really have answers for yet. The Provider Association members have been in discussion with what are you guys doing, what are your ideas? Unfortunately, there's really no easy button for that one. Oregon is looking at potential, what's the word I'm looking for, closures of public spaces. So we are looking ahead at what that means for individuals we support and social distancing and how we do that, because we have some folks, as you all know, going to be more of a challenge. So all of this is happening in real time and very fast. And as information comes into us, we are getting it out to our staff as fast as we can so they're prepared. But we are also trying to be diligent and not contributing to the panic with toilet paper and things like that. We have sent information directly to staff members about what the expectations are from the CDC as far as social distancing, and we are currently gathering creative ideas so that we can continue to support the folks in our care, but not contribute to any unnecessary exposures. So those are all things we are sorting through rapidly.
That's great, Lorelei. That's quite a bit of information. What I'd like to do, I think Lois has her sound fixed. I'd like to give her a few minutes to share information from her perspective. Lois, are you available?
I am. Can you hear me?
Yes, thank you.
Okay, great. So sorry about that. What a day to have my speakers die. So that was some mad scrambling. So I apologize for that. I was able to hear a lot of what Lorelei said, and I don't think I have a ton to add to that. A little bit in that I did want to clarify that Our DSA services, day services, have not been completely closed, although many providers have chosen to do that. They've basically asked for anybody who is still doing facility-based services to serve no less than 10 people at a time. And we did have some folks that were still doing some level of facility-based services. So some of those have closed or reduced how many people are there. But they're also still allowing DSA services to be fully community-based, which many of the providers in the state are. The risk with that, of course, becomes going out in the community. So we're still looking at trying to go to places, like, parks or places where you can use good social distancing from other people, avoiding crowds and all of that kind of thing. But so far, they have not shut the door on those altogether. So I did want to clarify that. Where people have chosen to close, it's primarily related to staffing and just really making sure that we're being extra safe and being able to shift those staffs to work in residential programs rather than DSA. So that has happened with a number of providers as well. I did talk to Lilia Tenety, our state director, over the weekend, and it sounds like we're going to be getting some additional advice or guidance today or tomorrow around residential services. And it's really just I guess it's providing guidance around things that most providers have already done, as Laura Lee touched on, which is things like limiting visitors, but they'll actually put official guidance in place asking us to do that, to do some protocols around checking. And I feel like it's probably not too far down the road where we may echo what our state has done in long-term care, like nursing home services, which is to restrict visitors altogether, except under, extenuating circumstances like end of life. So I wouldn't be shocked to see that coming. On Sunday, our governor issued guidance that no gatherings of 50 or more will be allowed. She's been following pretty quickly within a day or two what the Washington governor has done, because they're ahead of us, of course, in terms of the spread of the virus. So it wouldn't surprise me, and there is rumor that she will also be issuing or closing bars and restaurants, which Washington did very recently as well. The other question that you had was how are we partnering with other providers? And I think that Aura has done a lot of just kind of having, very much like I see happening with ANCOR nationally, those kind of just statewide chats where all of our executive directors are sharing advice and concerns with each other and ideas about how they're addressing various things. We have programs that have partnered, organizations that have partnered with each other so that if they get hit hard, that they can partner in terms of providing services. So for instance, if they have between the two agencies 5 people with the virus, that maybe they'll move those into the same home. So you have one home, even though there's 2 agencies supporting those folks. So there's been agencies that have set up those kind of partnerships that we've helped facilitate. I would say the other thing that we're building is just a place where all of our members can get access to protocols and procedures around what other organizations are doing around the virus. So how are they shifting staff? How are they changing their organizational structure? What actual procedures in terms of hand washing and hand sanitation and kind of decontamination between sites and all of those kind of things are they putting in place, and what do those look like? So just kind of a big resource sharing piece that we're starting to build. That was a suggestion that we got over the weekend.
Lois, I am going to interject with just one question that's come through the Q&A because it's specific to something you referenced. The person is asking for you to clarify, are site-based services, day hab services, limited to no more than 10 people in the building at one time?
Correct. Yes, that is correct.
So how is that operationalizing?
Organizations are either, some have just chosen to close down the service altogether. Some have chosen to do it in shifts. So whereas they might have run services from 9 to 2, they now run 3 shifts of services from, 8 to 1 and 1 to whatever, so that they have people coming at different times during the day. Some have shut down services for part of the people. And only are maintaining services for some folks. And then some are just shifting them to doing small group community stuff, which they so far have not, stopped, as long as you're, doing that in a wise way. Does that answer the question?
Yes, I think that that's helpful. I'm not going to continue to take questions during our speakers' presentations, but that one was specific. So I wanted to just share that. What I'd like to do now is shift to Scott Livengood from the state of Washington. I'm going to ask our speakers, if you're not engaged in your presentation, if you could please mute your line. It just helps with the audio quality for the briefing. And Scott, we asked to participate since, as you all know, Washington State was one of the first in the fire on this issue, and so we're hoping for some updates as to what's happening there. Go ahead, Scott. Thank you.
Sure. Can you hear me?
Yes.
Okay, great. So as Donna said, Washington was one of the first, and I think still has the largest number of active cases. Currently, it has 769 COVID-19 cases and 42 deaths in the state. So the overwhelming majority of these seem to be in the King County area, which is Seattle metropolitan area, and over half of the deaths are connected to the nursing home that has been in the news. To my knowledge, which it's not actively shared, but I think there's only one confirmed case that's in a supported living setting, but more on that to come, I guess. State of emergency in Washington was declared back in February 29th. Recommended limitations on business activity soon followed, first week of March, and some school closures, mostly around King County again, started around that time, and as of today, all schools in Washington are closed for 6 weeks, and so until April 24th. In addition, starting tonight, restaurants and bars are to be closed for the next 2 weeks, and gatherings over 50 are now disallowed. So the governor has continued to issue various proclamations, seems like almost a daily basis, so we're trying to track all of those. There are some that at a request did put some suspension on training requirements and continuing education requirements, but there's some others that we're still requesting that hopefully he will act on. Legislative session was in during this time, so the state did appropriate $200 million to address the issue. Obviously more will be needed, but that was sort of a starting point. The state has submitted an Appendix K for all the 1915 waivers, an emergency change to 1115 waiver, emergency changes to the state plan, and an 1135 emergency waiver as well. Washington State around Seattle had the first drive-up testing location for COVID-19, but it was specific to certain workers, mainly around University of Washington and certain populations, so they're supposed to be expanding that over the coming days, which is greatly needed. As far as providers, unlike most state association execs, I'm also a provider. I run a nonprofit agency that does this work. So we have had contingency planning around pandemics, and we just continue to adjust that on a daily basis as things come up as we get closer to possibly a full lockdown in the state. Quite a bit of information on a daily basis seems to come out from Department of Health and Public Health, including best practices, preventative measures, limitations on visitors, and monitoring of health conditions. Much like what Oregon said, we are restricting visitors to the homes, doing some checks as they come in, questions about their general health, questions about any travel, and we are doing temperature checks as well as any visitor, even if it is a family member coming through. Washington is a divided state, which many people don't know, and so most of the cases seem to be in Western Washington. Eastern Washington, which is obviously closer to Idaho, very few cases have arisen, and some of the first ones were this last weekend. For providers, I think the biggest challenges have been getting supplies and PPE. We have been sharing resources among ourselves about where we can possibly find these things. Many of us have turned to ordering from different countries to have them shipped in. We are hearing that we've completed requisitions through the counties, and we're hearing that the feds will be releasing some supplies to our state soon, so hopefully we can access some of that. The biggest challenge we're facing as of today is staffing. With the schools closed, we are faced with a large contingency of our workforce needing to take care of their children. So part of the proclamation when it came out was that each school district had to offer some child care option for first responders and healthcare workers, and our employees were included in healthcare workers. So we're trying to provide employees with those resources and how they apply for that child care, because it's very limited, but hopefully they can take advantage of that. One of the other challenges really has been the support from the state. The governor's been very active, Department of Health, but from our DDA administration, communication has not been the greatest, and so we're trying to get some additional waivers on some rules, suspension of rules to help us out during this crisis. We've continued to learn throughout this, and thank you to ANCOR and a lot of the members for sharing their contingency plans, their pandemic plans that many of us have used. But as we've gone through this and things have come up, we've had to adjust those because we learn as we go through. I think the biggest learning has been, as someone is a possibly positive case, how do you react to that? And so we've had an individual at our agency who had to go in for a doctor's test, and they actually ran a COVID-19 test. And so that became an isolated program where we had to isolate the clients in the home. Staff per Department of Health were allowed to go back and forth for shift as long as they wore PPE while we were there, so it didn't have to become a quarantine site. Quarantine only is when it's an actual positive result. So we've adjusted our plans to delineate that. We've taken a lot of precautions with limiting exposure. I walked through some of the things that we're doing. We're also doing temperature checks on employees when they arrive for shift, so that we can gather that. If they do have something above 100.4, they are sent home. We have tried to support the staff as much as possible in giving them various resources that they can access. The state has put into place quite a few emergency waivers around unemployment. We do have paid family leave in Washington. They made an exemption for child care issues in this industry as well around that. And some emergency rules around unemployment as well if it does become an issue. I think the most important thing that we've learned during all this is, just as most of you know, how incredible our staff are, how dedicated they are. And even though they're worried about their families, their children, and themselves, they continue to show up each and every day. So we are just, as all of you, just working.
Well, kudos for that, Scott. That's really encouraging news. I'm glad for your organizations and, of course, for the people you support, that your staff have been so dedicated and flexible. Okay, so again, the questions are coming into the Q&A function, and I'm going to hold them till we get closer to the end. And at this point in time, I'd like to welcome Amy Stade. She is the State Association Director for CAP, the Kentucky Association of Private Providers. And Kentucky got out of the gate pretty early with a Medicaid provider letter that spoke to some of the needs that providers are saying have to be addressed. And so we wanted to ask Amy to talk about that, other guidance they've issued, and how that's working in Kentucky.
Thanks, Donna. Can you hear me okay?
I sure can.
Okay, awesome. So as Donna mentioned, Kentucky sort of got out of the gate quickly. Our first case was confirmed on March 6th, so we're 10 days into this. At this point, we have 21 reported cases in 5 different counties. We have really small counties here in Kentucky, and all of our counties are, the 5 counties that are affected are right next to each other in central Kentucky. So it is sort of isolated at the moment in central-ish Kentucky. Today, the governor announced that all bars and restaurants are closed for in-person service, but they will still be allowed to do takeout, delivery, and drive-through service. Daycares, he announced, will be closed by the end of the week. There will be provisions for healthcare workers for daycare. He's still working on that. And something that our association is working on is getting direct support professionals included in that definition of healthcare workers to make sure that they have childcare, because all of our schools are also closed in Kentucky, or at least all of our public schools. The governor has also asked hospitals to cancel all of their elective procedures to make sure that we have capacity if and when this scales to a critical level in Kentucky. Our day training centers are open for now, but I expect that they'll probably end up being closed. And many of them have just chosen to close. We have no public gatherings over 50 people. Most of our churches have canceled. We have a state of emergency. And the governor also loosened the restrictions on unemployment. So there's no longer a waiting period, and there will no longer be job search requirements for the foreseeable future. However, that doesn't help our 1099 employees, and many of our waiver service provider employees are 1099 employees. So we've been working closely with our Medicaid agency. We have a brand new leadership team in Medicaid. We recently had a change in governor in December, so we have an all new team. Thankfully, they've all been in the state, and they've all been in leadership roles in the state previously, so they've got a lot of experience, and they've been really open to partnering with us, which has been an asset. Last week, our Department for Medicaid Services issued guidance saying that case managers will be permitted to satisfy their face-to-face requirement with either a FaceTime or a GoToMeeting or a phone call, as long as it's HIPAA compliant. So that's really helpful. And we got them to clarify that that was for all face-to-face visits, not just in a situation where someone is suspected of having the COVID virus. Today, they issued several provider letters, one noting that provider recertifications that are going to come up if your certification as a provider is going to be expiring soon in your annual audit and review. They're suspending all provider certifications for 60 days, so they're just putting them off for 60 days. And we're going to try to get them, I saw that Bonnie posted a question. We're also going to try to get them to apply this 60-day suspension of necessary recertifications for things like CPR and first aid training, as those things would be difficult to get during this time of social distancing. They issued another provider letter today as well that said our waiver assessments, or assessments for someone to qualify for waiver services, those may now be done by phone. They forgot to clarify one specific assessment for our supports for community living waiver, which is basically our residential waiver. So we're waiting on more clarification about that. Again, we anticipate that day centers will be closed down, but they have not yet. Many of them are closed, but they are not yet. Unfortunately, most of our guidance has been really ICS focused. There's a big focus in the state on ICS, and nothing has been super HCBS community-based services driven. But here at us at CAP, we have been encouraging our members to follow a lot of the ICF guidance as well as the guidance from CMS. And I've created a 17-page guide for a quick reference guide for our members to view and apply to their own programs. And so many of our members have instituted things like visitor screenings, temperature checks, things like that, particularly in residential and in day training settings. We have really had to guide the state for our DD services. Again, like I said, they've been really focused on ICF, so I've really had to remind them that community care is not the same as an ICF, and that not all of the standards necessarily translate to a community-based setting. I sent our Cabinet for Health and Family Services a letter today, a pretty lengthy one, and we've asked for flexibility and increased reimbursement for residential providers, particularly to combat the staffing issues and the overtime issues that they will face to staff truly 24-hour care. Because we need further guidance in Kentucky, and we've asked for this on community-based services like supported employment and community access, where you're truly getting out into the community. And so we've asked for guidance on that, and if those services should still be rendered, and if so, what precautions should be taken while those services are taking place. We have partnered with our Medicaid agency, and they've adopted several already, which I mentioned earlier, several of the ideas that we've asked for, which is we're very pleased with and we're really excited about. As I mentioned, we're trying to get DSPs included in the definition of healthcare worker. So all of these great privileges or exceptions that are being made for healthcare workers, we want to make sure that our DSPs are being taken care of too, because while they're not nurses and while they're not doctors, they're so important, and they are delivering healthcare-like services in a community setting, which is even, honestly, far more riskier for exposure than it is in a hospital, because they're coming and going in and out of the community into various homes. And we want to make sure that our DSPs in Kentucky are taken care of. Another thing that I don't think has been addressed by other states yet, but as you all know, the federal COVID package contains a 6.8%, possibly, if it passes, contains a 6.8% federal match. Right now, we're in the middle of a legislative session in Kentucky, and it's a budget year, which is thankfully good timing for us. So we're trying to get language in our state budget for temporary language that would require that a certain percentage of any money drawn down as a result of this increased federal match would be earmarked for DD services to make sure that RDD providers can afford to keep the doors open and afford to pay their staffs with the massive cost influx that they're getting ready to experience. So I'm working now trying to craft that language and come up with a specific percentage. I'm thinking maybe 3 to 4% of that 6.8%, but again, I have to work on the numbers a little bit, and I'm in the beginning stages of that. I think that's all that's happening in Kentucky at the moment. Yeah, that's all I have.
That's great, Amy. Thank you so much. We've been getting a number of questions asking if you'd be able to share your guidelines and the letter that you referenced. So if that's possible, you can send that to me, and I'll get it on our COVID webpage. If it's more of an internal document, that's okay too. Just let me know.
No, I'm happy to send it.
That's great. We've also had a couple questions around to all four of the presenters. What are some of the specific asks that are being embedded in the emergency waiver requests? What I can share at this point is so far we know that Louisiana has submitted an Appendix K emergency waiver. Florida has submitted an 1115. Washington, as Scott shared, has submitted all of the above plus an 1135. And Pennsylvania is expected to drop their Appendix K pretty much any moment. The majority of the states responding have said that their states are working on one form or another of these, and there seems to be some pretty consistent themes that are emerging, although certainly every state has specific requirements or provisions that will need to be addressed. I'll let Shannon talk a little bit more when her time comes up about what ANCOR is doing on that front to help support the state's asks. But we will be continuing to collect that information as it comes in from the state associations and compile that for people for your reference. So at this time, I'd like to welcome Brian Riddle. He is the owner of Professional Medical Fulfillment, who is a new ANCOR partner. So Brian, you have the floor.
Thank you very much. It's an honor and privilege for us to be new partners with ANCOR, and we look forward to being able to serve you guys. And so I wanted to share a little bit what we're seeing here, and probably everybody else is seeing the same thing about the availability of PPE supplies, equipment, and disinfectant supplies. And I'm going to let Logan, our purchasing manager, talk a little bit about that.
Hi everyone. So as I'm sure you all know, PPE equipment's been quite the challenge to get. So what I was able to do after talking to Brian last week, we were able to bring 8 cases of disinfecting wipes in to reserve just for y'all in case you need it. They are now out of stock, so that 8 cases is all we have for now. But there is 6 canisters to a case. So hopefully that'll at least help a little bit for y'all. As far as masks and gowns and all that goes, there's still a mass shortage of that. It looks like the gowns might potentially be on the way, but again, that's going to take a while for them to actually come over here from overseas. As far as hand sanitizer goes, the individual bottles are still on a shortage, but it's looking, after talking to the manufacturer Gojo, that they're going to be bringing in some hand pump dispensers, like wall dispensers, for us to be able to ship out to homes and things of that sort. And they are preparing to have the refills to use those dispensers. So all of that, as far as alcohol-based products, what the hope is from all the manufacturers is that by next week, we'll be starting to see a normal stock of that. Because what they're doing basically is mass producing only a couple of the products. So one being that hand dispenser and refills, and the other being they're doing the 4-ounce flip tops as far as hand sanitizer. So the goal for everyone that I've spoke to is by next week that should be able to normalize a little bit more. So that's some good news. As far as disinfecting spray, that's still on a shortage. But then as far as things like gloves and of course, the adult wipes, personal care wipes, that sort of stuff are still good to go and fine for now. So that's kind of the update on that. Hopefully things will start getting back to normal sooner rather than later. Anything to add to that? And then as far as regular supplies, nutrition, feeding stuff, briefs, underpads, any sort of incontinent stuff, all that's still in stock and, good for us to provide to y'all. So it's really just the PPE equipment that's the issue right now. All normal supplies that are needed, we're not having any issue with any of that at this time.
That's great. Thank you, everyone from PMF, excuse me, for those updates. We will make available on the ANCOR website information on how to contact you.
Thank you.
And yes, absolutely. Thank you for making the time to be with us today. I appreciate it.
I was about to say, and as far as anything, like if y'all are interested, and especially in the dispensers for the hand sanitizer and stuff, if y'all will reach out, I think y'all said to email Jessica or Brian about that. They'll get with me and we'll of course do everything we can for y'all.
Super. We really appreciate it. I mean, this is such fortuitous timing for you and for us. So thank you. Now we are going to shift gears a little bit. We've got Shannon McCracken, who is our Vice President for Government Relations. She is going to talk with you about our strategy, the ANCOR strategy, and what some of our updates are. And after that, we'll turn to some questions and answers. So Shannon, take it away.
Thank you, Donna. Hello, everyone. Thank you for tuning in today and logging on and taking the time to do this. We are so sensitive to the fact that daily life for you out there is it's different for everyone, but having been a provider myself and recently, I know that this just adds pressure to an already stressful day where you're always trying to find people to cover shifts and manage call-offs and things like that. So we truly understand that this crisis only exacerbates it in a very big way, and that pressure is on you. So thank you for taking time to do this. We'll also be asking you to take a few minutes today, a very important 2 minutes or 3 minutes to do action alerts to help reinforce our work. So just wanted to make sure that you knew that, and some traffic on our ACC last night. Everybody's tired. We're a little bit, I mean, everybody, I'm talking about all the providers, members out there, you guys, I know it's just difficult. So we just want to make sure we keep giving you good information and know that we're working for all of you, big, small, for-profit, nonprofit, everybody that's providing services out there for people with IDD, and really focused on, health safety as we're talking about here today, but also those DSPs and how we support them and manage not only the scheduling, but to take care of them too, when they're, needing to be with their kids who are out of school, needing to, or when they're sick themselves. So there's just so many things that you have to worry about, and just know that that's top of mind for us too, and how we listen to you and gear our response and our efforts towards what directly helps you and them at home. So in saying that, I'll tell you that tracking the information coming in from the states, is it incredible that it was just, 12 days ago that we had our first webinar where we're just starting to talk about what this is, and here there's some emergency waivers out there, and then now we are just full blown into requesting those waivers, and some states are really responding well, some are still struggling, but just the efforts of the state execs and those of you today on this call, just super proud of those efforts and what you're doing and understanding what this means. We have to always balance the rights and the push towards compliance on final settings rule. But I'll tell you something, everybody's life here today is affected. I'm sitting in my bedroom with my little kitchen table dragged into it for my makeshift workstation. Nobody's life is quote unquote normal right now. So, it truly is all hands on deck and trying to make sure that we take care of everybody and make sure they are healthy first and foremost and taken care of. So in doing that, we're also talking about the fact that we've worked for decades to create this network of community supports for people. And while they're at home, I mean, my office is still there, and I still have work to do once this time is over, where we're self-quarantining and trying to be socially responsible to protect each other across the country. We want to make sure that the provider network that we've built, that people rely on for their day supports, their supported employment, for any service that's out there, that once people come back out of their homes, that service structure is still there. There are huge concerns about that, the sustainability of day program providers and how they survive through this when they're unable to provide and bill Medicaid for services. So we're thinking about that, and we also know how it can sometimes all fall on the residential providers and become a double whammy in that case. So we got out front really quickly, trying to give you some questions and tools and ideas, and you all have run ahead of us in some of that, and others look back to us, and we're just trying to coordinate all those efforts to make sure that we're giving you what you need here at ANCOR. Not just the GR team, the entire team, from Barbara and communications and everybody. So sorry, I'm a little off my bullet points here, but that's just really important for me to let you know how we're looking at things and really focusing on what you are saying that you're worried about and what you need, and being sensitive to the daily efforts all around the services you provide. So that being said, just a little more, and there's not a bullet for this, but I know everybody, is curious about what's happening up here. There are, of course, as I mentioned, 12 days ago, there was an $8.3 billion relief package that was coming out. That's number one. The second one that the House put together, Nancy Pelosi working in conjunction with Steve Mnuchin at the Treasury Department, that was really fascinating to see, and I'm always grateful for people that partner together, whether they see eye to eye politically, and to get things done, and that's always the goal. So that was voted on in the House Friday night, early Saturday morning. We got a summary of that out to you yesterday before the Senate came back today to take that up. There was some back and forth on the ACC last night about potentially the questions around the paid leave, and there's just a lot of confusion around that. So I have someone analyzing that and getting specific answers to the questions and concerns that you all posted on the ACC. We pulled those and we'll have something out to you later today on that. Keep in mind, it's ever changing, and a challenge in this is just keeping up with the news, right? Because as soon as you read something and write something and turn around, it's different. It's changed, it's updated. It's just moving that quickly. So that is taken up in the Senate today, but we heard early this morning from Al that Al Guida, he's one of our contract lobbyists, that it may get kicked back to the House, that one. So hopefully that will come out and that relief package will flow through. The president, in the meantime, on Friday has declared a national emergency. This is not all new news to you, I know, but I'm just trying to put it in perspective for you. So there will probably be 3 more big fiscal relief packages that are coming out because unleashing the national emergency, those 2 big words, as the president put it, also unleashes $50 billion of additional funding resources, and it also, allows the options of some of the bigger emergency waivers. But those 3 packages will likely focus around transportation. And when I say transportation, I'm talking about the airlines and the cruise ship industry and all of that. And then just general economic relief to everyone in this crisis. And that's why our voice is so important to let them know that, we're concerned about not only our workers, but also our businesses at every level that allow these services to be provided in the community. And then a healthcare package. So not necessarily in that order, and not necessarily meaning that, we fall into one clearly or another. We're working on all of it. So just more specifically, and back to our agenda, which really changed from this morning to this afternoon. That's just how we're all rolling with this issue right now. We are looking at, building an ask towards these fiscal asks, but also something to keep in mind that there are 2 bills working in the Senate right now. They're both bipartisan, and they both specifically have language around our DSPs, around hazard pay, and things like that. I cannot get into specifics with you on that, and it's not ready to be shared, but I just wanted you to know that our team is working closely with Hill staffers on that language in the Senate right now. And we have some good support. So when we're ready to, and also there's some potential to, for MFP to go into that, and also for our hospital bill to go along, some opportunities for that. So we're trying to cover that. Oh, and also PPEs are included too for our DSPs. Okay, that's about as, I have to be that vague with it for now because we don't want anything jeopardized that we're working on to share too much. But those things are being worked on right now, as well as that 3rd package, that 3rd fiscal relief package. That was being crafted this morning, and people are feverishly working on that. So just to let you know, I just wanted to just share with you what's happening. So because we have a couple of things we're working on in the Senate, and we have people who understand our needs and are listening, and we have some good opportunities there, we want to focus our action alert today on the House specifically. So we'll be sending that out by the end of this call, and it's so fresh, I don't even have, it's just on my phone, so I can just share with you, but we're really targeting the things that I just talked about. And we have our voter voice tool that most of you have used. If you haven't, you know, I know everybody's busy, and somebody on my team said that this morning, like, I'm afraid people will be so busy they won't do this. And I just want to appeal to you that, you know, you have time to do this. If you're looking for ANCOR to support you, we need you to do this to help us elevate this work and be heard. Literally 2 or 3 minutes into everyone that you can for your congressmen and women. We'll be sending that out quickly. I have so many emails, I can't even pull it up right this second to tell you some of the text language, but it's really important, and it's around the very things that we've been talking about, including the sustainability of these providers and ensuring that our DSPs are protected with the equipment necessary to provide their support, that they're also, you know, supported to be paid and receive hazard pay for healthy workers if necessary. All right, so that will come out. And Barbara is also doing an op-ed around those supports. We're just really looking at this as a, you know, as a big multi-pronged approach to support our asks. So we have the ask, we're gonna need your action alerts to get to Congress, get the House members, and let them know what we need, who we are, and why this is important, why it's urgent. We're also pulling together, we're working on some news stories. We're getting, you know, when we get an opportunity to weigh in on this issue, having this consistent message is so important. Barbara's op-ed will be, you know, facing Congress to be, you know, to really talk about this and shedding a light on this support system and the workers that do it. Let's see. Oh, here we go. On the state efforts, all your letters and things, thank you for pushing those out. It's so important if you can take a second to flip it to us when your state gives guidance or you issue requests for guidance to your state. We pulled together our team last night, and we working really diligently to make sure that our state tracker page is up to date and live, and we're even or have all live links, that it's user friendly and it's current. So when you go to a state like Washington State, we can have links to everything and dated guidance so you can follow that, as well as these Appendix K waiver submissions as they are starting to come out or come in this side from the states. So I just encourage you to keep sharing that just for the benefit of everyone. We're trying to really increase our efforts to pull that together in a meaningful way, not just as a resource, but to do an environmental scan to see, you know, what states are doing that really pops up. We saw some guidance today, I think it was New Mexico, that's very specific, very direct as to what this means when they're shuttering a day program and people are at home, and it allows the providers to, you know, support each other, provide some of those day supports at the home temporarily. I like to think of it as a work from home option for the people we serve. Nobody's keeping people at home right now. We're all being kept at home right now just to protect each other. So looking at that in a really reasonable way. So we're doing that, but also the final step in that is, and connecting those dots, is to take the environmental scan of what states are doing and what you're saying you need. And then we are writing a letter today that we'll be sending to CMS and telling them some trends of what providers are asking for, what you're needing, what FAQs did they not cover in the initial guidance, where those gaps are. We've identified some of those. And then lastly, asking for a blanket approval of any 1915C Appendix K waivers or any emergency waivers that come their way regarding these issues for community providers, for people with IDD, home and community-based providers, period. So that's a lot. It is a lot, and it's really important, and it's fast and furious work. So look for that action alert soon. It should hit your inbox soon. Okay, and on the conference, we also are canceling the in-person event in Miami. You all were talking about the changes to limiting 50-person events. That's pretty much across the country right now. So that was inevitable that it needed to happen, but we are working to see what we could do to convert much of that to a virtual conference experience. So more to come on that and those details.
Yes, Shannon, and if I could jump in just for a second.
Yes, I think I'm finished. I'm sorry, I covered it all and then some.
No, Shannon, I don't think you'll ever be finished, and we don't want you to.
No.
So thank you.
No, I never lost for words either. So.
Yeah, no, I just wanted to build a little bit more on your announcement that we are not shortly, within the next hour, and maybe it's already hit your inboxes. We're sending an email out to everyone who's registered for our conference and all of our ANCOR membership that, as Shannon said, we're not actually canceling the conference. We're just not going to be meeting in Miami. Clearly that was inevitable. We were waiting for the right timing on it to make it crystal clear. But the reason why we're going to ask everyone, and you're going to see this in the email, hold off on contacting us, hold off on trying to cancel your registration, because our staff is working really hard, as Shannon said, and trying to figure out how much of the really great content that we have, we have so many speakers. We've got some terrific keynote speakers. We're reaching out and trying to figure out how much of that we can convert to be shared with all of you virtually, or in a more straightforward digital format. So hold on, the email's going to come. Sadly, we're not going to be in Miami at the end of April, but boy, given everything that's going on in the world, that's the least of the sacrifices that folks are going to make. So yeah, so back over to you, Shannon, or to Donna.
Thanks, Barbara. I'll take it from here. I'd like to try to address some of the questions and answers that have come through the Q&A, but before doing so, I realized that I had forgot to introduce PMF, not only as our newest ANCOR partner, but as our newest gold partner. I apologize, Brian, for not highlighting that before you spoke, but we will have information about their company and their services up on our website along with this other information. So just wanted to make a point to share that with members and to say thank you to them.
Thank you, Donna. I look forward to serving you guys.
Great. So what I'd like to do now is shift over to some of the Q&A. So from our presenters, do we still have Lois or Lorelei on from Oregon? I think that they had to drop off. So we had a couple questions for them.
Lorelei is here.
Hi, great. So one of the questions that came through was regarding CDC social distancing guidelines with staff, and how are you implementing that at home versus when you're in the community?
We have not implemented that at my organization, which provides residential services. At home, between clients and staff, if they need to provide care, upping the PPE, of course, if an individual is sick, not necessarily with COVID-19, but any illness. We're really trying to keep all illnesses down. But out in the community, making different decisions about where we're going. So, for the health and well-being of many of the folks we support, they have routines of getting out and about and maybe we choose to go to a park or somewhere where we can just walk around and not be in close proximity with other people. We are encouraging hand washing every time individuals go out in the community and come back into the home. So it's not just the visitor who stops by, it's every time we're out in the community and come back, putting those hand washing techniques into play. So that's been key.
Great, thank you. A question, I think, for Scott. Someone is asking, what types of precautions or limitations have been put into place for hourly services? And this could possibly go to Oregon as well. As opposed to residential services for those you support on more of a drop-in basis, or people who are living home with their families, are you changing any of your practices for those individuals?
So maybe punting it over to Oregon, but as far as what we're providing here, it's mainly residential, in-home, 24/7 care, so there has been no limitations at this point. In those that are billable services, like community inclusion, which is something where our staff are going out into the homes of others and helping them access the community, that's been limited on a case-by-case basis because some of our staff are going into nursing homes or assisted living or adult family homes, and there's been some limitations there. So it's decreased the billing and decreased some of the hours that those staff are working. But for the 24/7 care, up to now, it's continued as is.
In Oregon, providers are looking at what services are considered essential versus non-essential. So the life-sustaining types of support from going into somebody's apartment and helping them with medications, that still needs to continue, of course, but maybe, doing the community activities are things that don't need to continue. So case by case, evaluating what things are essential and non-essential.
Great, thank you. Let's see, we have Dr. Rader on the phone, and there's a question here about guidelines for employees or visitors being assessed for signs and symptoms of illness prior to entering a program location. Do you have any information or thoughts about that, Doctor?
Yeah, probably nothing that's going to raise any eyebrows. Obviously, the information for symptomology and the evaluation of symptoms comes from the CDC, the NIH, the Institute of Medicine, and local state departments of health. And, just basing it on the three cardinal symptoms of a fever, cough, and possibly shortness of breath, that should be the criteria. We would hope that the DSPs and other related staff would be self-monitoring and self-relegating those things. But yeah, in fact, at my agency, we're a community-based agency. We have monitors at our doors now, basically, with taking temperatures and asking those questions and having people sign in and sign out. The problem is, having any one of those signs is not pathognomonic of actually, having the virus, but it's just basically scrutinizing them to the best of our ability based on the knowledge that we have at this point in time. The last thing you want is for DSPs basically to possibly put our individuals at risk, but we also understand the pressure of having staff ratios, et cetera. But I think if somebody has anything to do, including their exposure in their own families, that they should be denied access to the group homes or to day programs for that matter.
Okay, thank you, Doctor. Another question for you, or possibly for Brian, is if hand sanitizers are past their expiration date, can they be used? And if so, what might that window be? Or are there guidelines around that?
That falls into the same heading and the same questions about how effective are drugs that have an expiration date. And obviously, the effectiveness of drugs has a trajectory of itself depending upon how long it's stored, how it's stored, et cetera, and basically the protective coatings on them. Certainly the best practices are to dispose of any drugs or any medications past their expiration date, but certainly in a pinch you can use them, and I would say, just my own personal opinion, you could probably use that same edict for hand sanitizers. I would certainly think that the hand sanitizers could be effective in a pinch. If you can't get access to fresh ones, I would certainly think 3 to 4 months would certainly be effective in a pinch, and I want to emphasize that. We're certainly not endorsing using them with complete confidence past their expiration date.
Understood. Thank you for that. Let's see. We also have a question for Kentucky. Nope, I'm sorry. That was a clarification from Kentucky. My apologies. So here's another medical related question. Is quarantine only for those who have had a confirmed test, a positive test, or also for confirmed exposure to a case?
Yeah, by definition, the best practice is basically designate quarantine for the designated cases that have been determined by testing. Social self-isolation is basically the practice when you are suspected of it. But in terms of medical legal definitions, quarantine is for people who have been clinically determined by a test to be positive for the virus.
Thank you. Thank you for that. We do have a number of other questions that have come in. Many of them are, I think, state specific, or the answers will vary based on decisions that individual states make, and I don't know that it's necessarily questions we want to put to these particular presenters. So with that, I think we're going to wrap up this briefing. I wanted to give Barbara just an opportunity, or Shannon, to share any last minute thoughts before doing so.
Thank you, Donna. I appreciate the opportunity. Leave it to ANCOR members to be very ingenious and for some ANCOR members to insert a moment of levity in all of it. Shortly after sharing that we're going to try to take as much as we can of the conference virtual, the wonderful Lynn Megan, who serves on the ANCOR board, the ANCOR Foundation Board of Directors, has offered to do a virtual cocktail party. So that's, we'll try to figure out how to make that work. But actually, really seriously, the hardest thing about not moving forward with the in-person conference is not just that we all love Miami and we could all really use some warm weather right now, but always the highlight of our annual conference are the Direct Support Professional of the Year awards. So we're going to be in contact with all of the folks who nominated the awardees from all of the states, as well as obviously the Direct Support Professional of the Year. We are going to be putting our heads together to think of the very best way that we can share their extraordinary work with all of you. But I just wanted to put in a plug before everyone hung up. NADSP, the National Alliance for the Direct Support Professionals, has put together a terrific webinar. Dr. Radar presented on it, and it is directly for direct support professionals. And it's all about helping them and supporting them in navigating this coronavirus epidemic. You know, they are on the front lines. You know, they are the ones that we all take our hats off for. I was just quickly looking on our website, our COVID-19 webpage. I actually couldn't find the link to the webinar there. I might have overlooked it, but we'll get it up. We'll contact NADSP right away. I think that it got recorded. It was really terrific, and I commend it to all of you. So thanks so much for taking the time with us. We'll keep plugging away at it and stay healthy. Thanks, Donna, for organizing this. And thank you to all of the presenters who took the time to share with us what's happening in your states.
Great. Thanks, everyone. Thank you so much.